Be careful now.
We have been able to contact by radio 1/3 of the staff, but so far we have not heard of any important injury or death.
The Pan American Health Organization, World Health Organization, reports that its staff in Haiti has suffered no casualties, and it quickly mobilizes to respond in support of Haiti's Ministry of Public Health and Population.
We're going to go down this way. I can't go.
Two entities play a crucial role in this first phase of the response: PROMISE and the Health Cluster. The Program for Essential Medicines and Supplies, known as PROMISE and managed by PAHO WHO, is the central point for donations and distribution of medicines and supplies in Haiti. PROMISE's warehouse was partially damaged by the earthquake. The United States Army, in a reconnaissance mission, recognized the value of PROMISE's inventories and proceeded to establish a security perimeter around the warehouse. Despite the devastating impact of the quake, PROMISE's Haitian staff showed up for work, and the warehouse resumed operations, providing medicines and supplies that saved the lives of thousands.
Je pense sincèrement que je dois dire, sans cette structure, nous ne serions pas en mesure d'apporter les soins médicaux à la population.
International agencies that need assistance with drugs, medical supplies, should see Dr. Malek.
In parallel, a special health cluster was set up under the leadership of PAHO WHO. It was charged with coordinating, sharing information, and avoiding duplication of efforts among agencies and organizations doing health-related relief work. They included non-governmental organizations, UN agencies, donors, and volunteers in search of information or offering services and supplies.
It is a big challenge to facilitate coordination between all these agencies, but I think we can see progress. We can see progress. We can see now agencies who come to the health cluster and they request assistance from us. We receive more than 400 emails a day from health cluster partners.
The health cluster helps us come together and pool resources to be more efficient, delivering care, treating patients, and I think that just networking with other people and knowing what they're doing can make the healthcare better.
Faced with the urgent need to rescue and treat injured survivors, but with Haiti's hospitals and health facilities severely damaged, many Haitians began taking victims of the quake for treatment in border areas of the Dominican Republic. Hospitals filled quickly, and temporary facilities were set up to absorb the overflow. The Dominican Republic, in a display of Pan-Americanism and solidarity, opened its doors to its neighbors in search of help, and became a key partner in ensuring the continued flow of medicines and supplies.
Desde ese momento ordenamos que las unidades nuestras que reaccionan inmediatamente se trasladaran a Jimaní. Y desde ese momento comenzó una actividad operativa que no ha cesado. Es importante la coordinación, no en el momento en que ocurre un evento, sino la coordinación permanente. Que esto es lo que ha permitido que realmente nosotros hayamos sido efectivos en la respuesta y que cada uno de los programas haya estado presente con una coordinación adecuada, con un plan y una visión clara de lo que tiene que hacer en su momento.
Haiti's Ministry of Public Health and Population, with support from PAHO WHO, quickly defined priority areas of action, including water and sanitation, hospital waste disposal, safe blood, mental health, and ensuring the cold chain for vaccine supplies. Despite the earthquake, health officials knew it was vital to maintain routine healthcare programs and to ensure access to services such as maternal and child health and vaccination against preventable diseases. In April, Haiti participated in Vaccination Week in the Americas. It held a symbolic launching event at the Love a Child Hospital in Font-Parisien on the Dominican border, where thousands of lives had been saved following the earthquake, and where victims were still being treated 3 months after the quake.
Nous sommes ici en un moment de beaucoup de douleur, de mort, les premières semaines, mais aujourd'hui, nous sommes en un moment très différent, de joie, de célébration de la santé et de la prévention avec le lancement de la semaine de vaccination de les Amériques. C'est un effort conjoint de tout le monde uni pour la santé et pour la vie.
La semaine de vaccination en Amérique a illustré la force du panaméricanisme. Haïti, malgré les contraintes de toutes sortes, se battra pour que la couverture vaccinale s'améliore encore chaque jour davantage.
The process of coordinating and reorganizing Haiti's public health services, which were devastated by the quake, proves to be long and arduous. During this time, in compliance with the international health regulations, and because of the real threat of outbreaks of infectious diseases, PAHO WHO worked with the Haitian Ministry of Health to strengthen the national surveillance system, with a focus on the early warning system. Haitian technicians received training in methods for diagnosing transmissible diseases, including cholera.
Le 19, on a reçu vraiment des selles là maintenant qui a les caractéristiques. On a commencé à préparer les milieux spécifiques pour identifier le choléra. Et le 20, le lendemain matin, on a été vraiment très surpris de voir les colonies caractéristiques du choléra sur ces boîtes de TCBS que nous avions préparées la veille. On a fait le transfert sur le milieu qu'il faut, un milieu non sélectif. Ensuite, le soir, jusqu'à peut-être vers 9h30, on a enfin pu confirmer par le test d'agglutination que c'était vraiment du Vibrio cholerae.
Confirmation that cholera was present in Haiti marked a dramatic change in the post-earthquake panorama. Ongoing reconstruction efforts, which had inspired the hopes of millions of Haitians and their friends around the world, were suddenly set aside to make way for a rapid and effective response to a disease that was, until now, unknown in Haiti.
We established 3 cholera treatment centers, one in Verret, one in Gonaïves, one in Saint-Michel. We've delivered supplies to those locations and doctors and nurses. We're also training the medical staff in these centers in cholera treatment, cholera management, patient management, trying to make sure that they can keep themselves safe, but also ensure the recovery of the patients that come to them.
Mais ça dit nous des cholera, yo dit nous c'est un bagage son microbe lié. Son microbe c'est n'importe ça ou pas faire la bien ou attraper par microbe ça. Et ça fait faut toujours prendre précaution ensemble avec maladie ça pour pas entrer dans.
Nous sommes en train de faire une prévention. Nous travaillons dans 13 camps. De 13 camps en Haïti. Et ici à Cité Soleil, nous distribuons des flyers. Okay? Nous avons des agents communautaires qui ont des mégaphones pour parler aux gens, pour leur dire comment ils doivent prévenir pour ne pas atteindre le choléra.
When we first heard in the international community that there was confirmed cholera cases in Haiti, immediately the question was, how do we communicate as quickly as possible to as many people as possible what they need to do to fight this disease?
Avec, on toujours expliquer, on expliquer moun si moun, on expliquer si moun qui ça pour faire. Premièrement, on doit faire et prendre l'eau aller au sorti côté ça les toilettes là, les au sorti dans toilette, on toujours dit si moun qui ça pour faire. Avec si pour sortir dans toilette là, on toujours expliquer moun faut laver main.
It needs to be replaced. So this
Throughout the year, we have worked together and together have learned many things. We have learned how thousands of anonymous Haitian heroes have dedicated their lives and worked countless hours to improve their country. We have learned about unconditional love that even extreme poverty cannot suppress. And we learned that the best work is the work we do together, with hope and optimism and without expecting anything in return. We have learned that we are one team. Step by step, we will continue working together to build a foundation for a renewed country. Little by little, we will get back on the path to progress and development so that we can offer our children and all Haitians a country where their hope of a better life can become a reality every day of their lives.